Hi, I'm Dr. Sandra Lemanski. I'm an optometrist and owner of Palmer Eye Care in Austin, Texas. And today I wanted to talk to you about adapting to new glasses. Sometimes when you get a new pair of glasses and you come to pick them up after they've been made, you put them on, it may seem like something's not right. It may seem like you're not seeing clearly, or it may seem like the world moves kind of funny when you turn your head. Or you might look at something that is a square or a rectangle and it looks like a trapezoid. Those are all very common symptoms of adapting to new glasses. Other symptoms may include headaches, and some people may even feel a little dizzy or nauseous. And unfortunately, that is still probably a normal part of adjusting to new glasses. So a lot of times when patients do this, then they put the glasses on and they're like, oh, no, this isn't right. Take these back. I can't wear these. Please try wearing those glasses, because often it's going to take maybe up to a week or two to fully adapt to a new pair of glasses. But for some people, it only takes a few hours or a couple of days. But if you keep going back and wearing your old glasses, then that doesn't really make your eyes and brain adapt to the new ones. It's like every time you put those old glasses on, the brain says, okay, here's what I'm used to. I'm good with that. But the new prescription may actually be more correct. It's just your eyes and brain haven't adapted to it yet. And so it's not allowing you to feel comfortable with those new glasses if you keep going back to the old glasses. So if you do try wearing them for a week and you're still having problems with them, then I want you to bring them back, especially if we did your exam, if you got them through us. Please bring them back to the office after you've given your eyes a chance to adapt to them. And then we'll recheck things and make sure that there's not something else going on. And we can recheck a few things, just when you pick them up, if you say, wait, this doesn't seem right, we can kind of double check, make sure, that the basics look correct as far as, the lab made the right prescription and all of that. But it eliminates one of the most common variables if you allow your eyes to adapt to them first before we go trying to recheck the prescription. Because sometimes I have patients, this happens a lot. It seems like it's been happening a lot lately, and this is why I'm making this video, that a patient will bring their glasses back when they've only worn them for maybe a day or maybe just a few hours. And we can do another refraction, and I might find just a little bit of a different power than what we got when they were here for their exam. But that is within the margin of error for a refraction. When you're going through that process and you're picking which is better, 1, 2, 1, 2, 3, 4, sometimes it's hard to tell. Honestly, you can imagine where, there's one time where it's like, okay, I picked 2 that time, but if she showed me those again, I very well might pick number 1. That's a quarter of a diopter or maybe a half diopter difference, and that can be the margin of error. So if you come back and we recheck the refraction and we get it different by a quarter or a half diopter, then we're left wondering, if you haven't worn the glasses long enough, then we're like, okay, well, maybe we needed to change it by a quarter or a half diopter, or maybe they just needed to wear that first pair of glasses longer and it was just a matter of getting used to it. So it really helps us out to have you wear them longer before you bring them back in. And I promise we will work with you and we will get things figured out. Now, don't go 3 or 4 months, because number 1, it doesn't take that long to adapt. Number 2, we do have a somewhat limited time that we can have glasses remade through our labs. It might be 60, 90 days, I'm not sure. But give it at least a week, sometimes 2 weeks, but not more than a month, month and a half. And let us know if something's going on. So anyway, I just wanted to give that little PSA announcement to you guys, and hopefully when you pick up your new glasses, you won't have any problem adapting to them, and they'll be comfortable and clear right from the start. Happens a lot, but then just don't be surprised if one time it does happen the other way. It doesn't mean that anything's, the same person can normally adapt to them easily, and then all of a sudden one time have a little bit more difficulty. And it can have to do with even the shape and style of the frame, the size of the frame, or the way it sits on your face, how close to your eyes it is, or how far down your nose it sits, and all of that. All of those factors can make a difference in it. So anyway, thank you, and we hope to see you soon in our office.